Thank you very much, Lesley and Corda. So, look, there's quite a few amendments in this grouping, so I want to just try to deal with a number of issues. Firstly, I did note the comments of Dr. Peter Boylan yesterday, former chairman of the Institute of Obstetricians and Gynaecologists, former chairperson, or master rather, of our National Maternity Hospital, and the person that I appointed with the HSE to lead the rollout of the services. And Dr. Boylan did point out yesterday on national radio his view, and indeed my view, that there's many doctors ready and willing to provide this service. And I note, while all the media attention was on the minority of doctors who walked out of a meeting that they sought at the weekend, that the overwhelming majority of doctors stayed in the room, asked questions and worked their ways through it. And I do note, and this is not a criticism, it's just a fact, that many of the doctors now leading the charge on some of the issues Deputy Tobin and Dr. Tobin referenced were also some of the doctors who were leading the campaign for the no side. And that's fine. They don't support it. They don't want abortion in this country. That's their right as citizens. And I will defend forever the right of a doctor or a healthcare professional to conscientiously object. But I won't stand over conscientious obstruction. And I did say that. And there's a difference. There's a fundamental difference. Everybody, a medical professional, has the right to conscientiously object. That is beyond doubt. I don't think there's anybody in this House who disagrees with that. But if we're going to just keep talking about conscientious objection as though we had a referendum on doctors, we had a referendum on women. We had a referendum on women's healthcare. And you know what? Maybe we should actually think about the woman. Are we actually going to have a situation where a woman, maybe one who's been raped, turns up at her doctor's surgery and is shown the door, given the cold shoulder, out you go? We have thankfully, despite your best efforts, moved very far away from that Ireland, and I'm very proud of that. So let me be very clear. Let me be very clear to the legitimate questions raised by people like Deputy Aylward and Deputy Brazel and others, and to people right across this House. The law on abortion is changing, thankfully. The law on conscientious objection is not. And the wording being used, and Deputy Brazel asked me for clarification on this, the wording being used in relation to transfer of care and the likes is the same word used in the Protection of Life During Pregnancy Act. And what happens when wording like this is put into legislation? The Medical Council, the regulator, because I don't regulate doctors, the government doesn't regulate doctors, the Oireachtas doesn't, the Medical Council does. The Medical Council takes those words and transposes them into guidelines, how they interpret it. And I would reference people, as I did at the committee on many occasions, to page 35 of the Guide to Professional Conduct and Ethics for Registered Medical Practitioners. And it defines what conscientious objection is, what the obligation is. You may refuse to provide or to take part in the provision of lawful treatments or forms of care which conflict with your sincerely held ethical or moral values. If you have a conscientious objection to a treatment or form of care, you should inform patients, colleagues and your employer as early as possible. When discussing these issues with patients, you should be sensitive and considerate so as to minimise any distress your decision may cause. You should make sure that patients' care is not interrupted and their access to care is not impeded. If you hold a conscientious objection to treatment, you must inform the patient that they have the right to seek the treatment from another doctor and give the patient enough information to enable them to transfer to another doctor and get the treatment they want. If the patient is unable to arrange their own transfer of care, my words, perhaps they're unconscious, you should make these arrangements on their behalf. And in an emergency, you must make your patient's care a priority and give necessary treatment. That's what conscientious objection is. It's not this convoluted thing that some people have tried to make it out. And we've gone further. We're providing a 24-hour-a-day, 7-day-a-week helpline that will be staffed by healthcare professionals. Because here's another bit of interesting information. Women don't want to be going from doctor to doctor trying to find someone to help them. They'd like to actually be able to, as functioning, intelligent people, pick up the telephone, go on the internet and find out where they can access legal, safe healthcare services in this country. So the 24/7 helpline will provide non-directional information and will signpost. So we will significantly lessen the situations whereby a doctor will find themselves in that situation, and much more importantly, lessen where a woman in crisis will find herself in that situation. That's Ken Corley. In this group, I'm also bringing forward 2 amendments myself, because, as you know, we do defend the right of conscientious objection for doctors, for nurses, for midwives, and for student doctors, student nurses and student midwives. And student doctors were already covered because they tend to be they are registered with their council. But in order to be absolutely certain that student nurses and student midwives also have a right to conscientious objection, I'm bringing forward Amendment 52 and 53. In relation to the issue of pharmacists, and I heard Deputy Brazel raise this, and I know he's a pharmacist and very well informed on all of these issues, I would point to the Code of Conduct for Pharmacists that states that pharmacists must ensure that in instances where they're unable to provide prescribed medicines or pharmacy services to a patient, they must take reasonable action to ensure these medicines or services are provided and that the patient's care is not jeopardised. And their regulator, the Pharmaceutical Society of Ireland, actually put information up on its website on the referendum held in May, outlining how its statutory Code of Conduct for Pharmacists would work in that regard. Can we also dismiss this idea that I don't interact with GPs? And you don't actually have to take my word for it. Perhaps take the word of the clinical director of the Irish College of General Practitioners, who debunked that myth on RTE's Morning Ireland, because I've met the ICGP several times on this. You're right, I haven't met some individual groups of doctors who have different views in relation to this. I've met the training college, the college that actually trains our general practitioners. That's, I think, what my responsibility as a minister is. So, conscientious objection, let me be very clear on the record of this House, is a long-established and important principle in this country. I will defend the right of a healthcare professional to conscientiously object. I would expect an overwhelming majority of members in this House will do that. But I'll also defend to the death the right of a woman to access healthcare in our country, and we need to make sure that those two rights don't trump each other. Therefore, conscientious objection says, if you're opting out, you need to provide the information. To help you doing that, we're setting up a 24/7 helpline. So this is reasonable. There's some people who want to stymie and delay and prevent this coming in. They're going to throw the kitchen sink at trying to prevent this happen. Conscientious objection, fully respected. Conscientious obstruction of the democratic will of the people and healthcare for women will never be tolerated.